The coronavirus pandemic will result in its own unique set of challenges for primary care practitioners around the world. Many patients will have a longer than anticipated recovery from coronavirus, with many currently suffering from breathlessness and profound fatigue long after the illness has ended. There are some online modules available to help with rehabilitation, but face-to-face rehabilitation services may be required. April 2020 in the United Kingdom highlighted the end of the financial year for Payment for Performance or Quality and Outcomes Framework, or QOF for GPs in England. Despite this, I anticipate a worsening of long-term conditions. Fair Health, a health equity think tank, have suggested that long-term condition reviews should start with patients living in the most deprived locations on your practice list. Some parts of these reviews could be done remotely, but we must focus on how the person is coping rather than the disease in question. Many patients will be suffering unexpected, prolonged grief and post-traumatic stress disorder, especially if they have lost a friend or family member and were unable to visit them in their last few days of life. Undoubtedly, this may require focused counselling and help from mental health services. The reluctance of patients to contact their primary care practitioner resulted in a marked decrease in referrals for suspected cancer. This may result in a number of later presentations for cancer and worse prognosis. Clinicians should have an even lower threshold than they already do for referral for suspected cancer, but be aware that we may not be able to mitigate worse prognoses. We must consider our own physical and mental health as healthcare workers. It is likely that we will be struggling with the loss of fellow healthcare staff, friends, and family. I myself have shed a tear, and I don't think I'm a particularly emotional person. As well as this, we may be struggling to keep up with rapidly changing guidance and high workloads resulting in fatigue and burnout. Creating the space and time, perhaps every week, month, or even day, will allow team members to debrief and share difficult experiences. Remember, it's okay not to be okay. These are difficult times. One particular problem that sometimes is hidden from our view is domestic abuse, which is thought to have increased during the lockdown across many countries. The switch from face-to-face to remote consultations during lockdown means it's difficult for victims to disclose what they're experiencing safely. French and Spanish pharmacies provided the opportunity for victims of domestic abuse to attend pharmacies, and if they're unable to talk freely, they can say a key word to inform their pharmacist. We could use a similar arrangement in the United Kingdom, but this does not need to be limited to pharmacies alone. Perhaps the most worrying problem that will result from the pandemic is socio-economic. The result of a likely financial recession will push many people into poverty and homelessness. Two approaches may help this. A bottom-up approach may include the use of social prescribers, link workers, and the huge 750,000 volunteer workforce. However, we will need the help of a top-down governmental approach to help provide backing for state services. Primary care can provide a solution to many medical and psychological problems, but socio-economic problems will require socio-economic solutions. Governments worldwide must not forget the importance of well-funded and well-resourced state-backed services, such as healthcare and community infrastructure, both inside and outside a pandemic. Thank you for watching and stay safe.